Hi everybody, how are you today? I come to you from a different end of parenthood and childhood. I am deep into screen time. Access to screens and access to carbs is kind of the way I think about it. So we had a lot of that type of stuff going on at home. So this issue hits me pretty personally, although I'm out of the early childhood range in my parenting, so I'm very much out of my comfort zone. So what I really liked about the opportunity to speak here is that you were asking us to focus on the positive. Like, what are the opportunities? Where can we go next? And I think this is a time to really try to think positive, because there are a lot of handles, a lot of opportunities. There's a lot of things people are thinking about. There's a lot of activity in the state, but also, wait a second, that's actually the flip side. That's the negative. Trying to get people's attention, particularly my wonderful state child care administrators, and I think Melanie is here, and yes, hey Melanie. I don't know if others are here. There's a little bit going on in the world of early childhood education and care right now that's keeping people really busy. So that's happening. But on the other hand, we have to keep our mind on the positive. So things like we're going to get a regulation done by the summer of 2016 in the Office of Child Care. We try to keep really positive. So what I was asked to do was talk about what's going on at ACF and early childhood programs. And when I came in a little bit early, I heard you've already gotten to a lot of the details. So some of these slides might seem really high level and you might already know it. But basically what I wanted to communicate is how clearly health and safety are very much integrated, and nutrition into our priorities at the Administration for Children and Families across our programs. And I'm the director of the Office of Child Care. I'll hit on child care, I'll hit on a little bit Head Start, Early Head Start, and our other program, Early Head Start Child Care Partnerships, and some cross-cutting opportunities that we see. But one of our overarching communications and visions that we keep saying is that we don't see a different vision if you're looking in this program or that program. We've been trying very hard in this administration to work toward a world in which children get similar access to, for this crowd, the health, nutrition, and physical activity experiences that they would no matter which door they come through and what it's called. That said, child care is a block grant. Head Start is a program. So we have very different levers to be able to push to make these things happen. And so that's definitely a challenge that we face too, and I know you all see in the field. So for child care, you all know we had a major reauthorization of the Child Care and Development Block Grant in 2014 that has some new requirements and handles, some of which you're already talking about, but just to go back over, since there were some questions. So there's new training and other requirements, training and requirements for CCDF providers in 10 health and safety topics, which are listed in the law, but there's also the option to focus on nutrition and physical activity, and that is something that you can obviously be working on in states. There's an increased percentage of funding for child care quality improvement, both for the general quality set aside and specifically for infant and toddler quality. And there's 10 ways, 10 is a number that Congress must have been really focused on. There's 10 ways you can spend your money if you're a state, and the 10th is other. So that means the answer to the question about health consultants, can those be paid for out of this money? The answer is yes. You have to be able to show as a state that you can measure some areas of improvement, and then that's related to child well-being and some other measures. So that's pretty clear from this, what this opportunity is. The other things that people don't focus on as much that we also see as really critical, especially because we know parents are so much our partners in being able to really deliver this message, as are obviously our providers. But the consumer education and family engagement provisions in the law, and the opportunity to think about professional development for our providers, to work with parents, to think about culturally and linguistically appropriate approaches, all of those things are opportunities that could help move this type of conversation to our states and localities and to our child care programs around the country. Oh, and of course, I would be remiss if I didn't mention that if you're planning on commenting on our regulations, those are due February 22nd. And all of our states, why they're so busy, and I don't know, Melanie, I'm amazed you're here. Melanie is so committed to this issue. I want to give you a round of applause just for being here, because her plan is due March 1st. So, all right, so some of the other things that we wanted to talk to you about, you already know about. It's Let's Move Childcare, was just touched on. It's our partnership with the Center for Disease Control. That's been going on for several years. Well, on Head Start and Early Head Start, we want to also mention that, of course, health and nutrition are woven into the early learning outcomes framework. They're being strengthened through the provisions in the proposed rule around performance standards, and we have a specific project, the TABLE project, that is also working to work with programs management of the CACFP program. We also have the I Am Moving, I Am Learning program, and that is something that's really taken off. We also have the Little Voices for Healthy Choices program and Early Head Start. But what I want to shift to in my 2 minutes, which is probably 1.5 now, is how the things that have been program specific I just talked about are starting to move across programs and what we're trying to do. So we also have the Early Head Start Childcare Partnerships, which is an opportunity to bring the level of specificity about program standards that are in the Head Start, Early Head Start side into childcare settings. And we have 275 partnerships around the country that are really learning laboratories for how we get there in our childcare settings. What are the resources it takes to really move to delivering comprehensive services and this level of support for family engagement in those settings. We also have our Health and Wellness Center, which is a cross-cutting initiative as well. Head Start and childcare both put funding in here, and of course SAMHSA as well. And we are very happy that that was awarded to the American Academy of Pediatrics, and some group called the Moores is one of the partners, so that's good. And they're going to be really working to implement strategies to support healthy early childhood, weight, nutrition, all those things, but they're going to be really thinking not just Head Start, not just childcare, both. And we are in the process of really re-envisioning our technical assistance and how we get closer to the program level and the provider and child level in childcare, in addition to what we already do in Head Start. Last but not least is our cross-cutting support of the Caring for Our Children Basics, which is being referred to in both the Head Start and the child care proposed rules as a reference point for states that they can use, states and programs that they can use in implementing all these health and safety changes we've been talking about. So we think that's a good tool as well. So thank you for your work, and I will turn it on to the next speed reader.